Tracey Young, supporting Composite 13 on behalf of Unite. President, Congress. I work as a health visitor, a specialist community public health nurse, and my union, Unite, have been campaigning hard against the public health cuts that have been so devastating to all public health and community services, such as health visiting, school nursing, and other community practitioner roles that are so important to the positive development of children's health and well-being, and therefore must be fundamental to any child health strategy. Health visitors and school nurses are key to promoting child health through working in a proactive way at key points in a child and family's development. These are core public health preventative services promoting healthy lifestyles, identifying difficulties, and help give children the best start in life, yet they are under threat. When, in 2015, the commissioning of children's public health services in England were transferred from the NHS to councils, there were large in-year funding cuts to budgets made. Since then, health visitor numbers have already fallen by nearly 9%. The tendering process has not only led to cuts, but also privatisation, with no proper public scrutiny of the professional and skill mix of those services. New service contracts agreed between local authorities and private providers often prevent the high-level, more intensive support that some children and women with new babies need. For example, in supporting women through the breastfeeding process. We have already heard that breastfeeding is one of the main factors in preventing ill health, obesity and diabetes, not just in infancy, but throughout life. Let us be clear, Congress. Breastfeeding rates in the UK are appalling, with only 0.5% of babies still breastfeeding after a year, and that's in any form. This is not just the worst in Europe, but the worst in the world, and will not improve until we have a well-funded, appropriately commissioned public health service. Unite members have complained not only of cuts to services, excessive workloads, but also downbanding of their role. The cost of illness and disease is higher than public health and early intervention, work that our members carry out with dedication. These cuts and changes to commissioning of our community services are short-sighted. They will not save money in the medium to long term, and they will have a detrimental effect on population health now and in the future. Yes, we need a child health strategy, but we also need the professional workforce to deliver it. Conference, please support this composite.
Thank you.